Happy to have you. We're going to wait a minute and we're going to go live stream, and then I'll go through just a couple of housekeeping matters, okay? And to the members, there's some stuff for you in the back, all right? And we want to welcome Patrick today, right? He's with us today. Okay, wonderful. So good afternoon and welcome to the first official briefing. This is our first one during the 2024 legislative session for the House Health and Government Operations Committee. I kindly ask for your patience if we encounter any technical and streaming issues, because it's our first time and, you know, things will go wrong, but just be patient with us, okay? This briefing is being streamed on the Maryland General Assembly YouTube channel. Before this briefing, all members were emailed a copy of each presentation. If you do not have these documents, please let the committee staff know and we will send you a copy. But I must say our committee staff is very organized and I want to thank them for their work. And please adhere to our members to our usual committee rules of one question and one answer from the panel, not one question and one answer from each panelist. Please keep your question brief. Please keep in mind that this briefing is scheduled to conclude at 3 p.m. Today, the House and Health and Government Operations Committee will hear a review and updates on the Board of Nursing from the Office of the Program Evaluation and Government Accountability and the Maryland Department of Health. The committee will also hear presentations on the Minority Business Enterprise Program from the Governor's Office of Small, Minority, and Women Business Affairs, the Maryland Department of Transportation, and the Department of General Services. We will begin today with Michael Powell from the Office of Program Evaluation and Government Accountability. Mr. Powell, will you please come up? And I believe that you have with you as well Diana Winter, who's the Program Evaluator, and Grant Mayhew, Program Evaluator as well. Good afternoon.
We do. Good afternoon, Chair Pena-Melnick, Vice Chair Collison, and members of the committee. My name is Mike. I'm not going to reintroduce myself. You did a good job of introducing me. We conducted an evaluation of the Maryland Board of Nursing, published that in December. It actually came from a request from the former vice chair of this committee around this time last year. And as we get started, I just want to say we approach this trying to look at the Board of Nursing from the perspective of nurses and from the perspective of patients in the state of Maryland. So it was not a top-down look. We wanted to look at things from the perspective of the people that the board influences and interacts with. On the next slide, I just want to give you a sense of the scope of the Board of Nursing. So at any given time, they have something like 100,000 active licenses and 300,000 active certificates that they oversee. That is partially because a person could have multiple certificates, or you could have a license and a certificate, but they oversee a large part of Maryland's workforce and Maryland's population. On the next one, please. I want to do something I've avoided for 4 years so far, but which is to sort of generally summarize much of what our report says. And we've all heard stories about the difficulty people have had dealing with the board in the past, and those are true. But I think for the average, and I'm going to call them nurses, even though I know some of the people overseen by the board are not technically nurses, but for the average nurse, it's a fairly straightforward transaction if they're trying to get licensed, certified, relicensed, et cetera. And you can see on this chart, you know, the average amount of time it takes to get your APRN license initially is a week, 7 days. To get a renewal license, 2 days, 3 days. So for most people, it's pretty straightforward and easy. Could it be a little bit easier? Probably. Could it be a little simpler for the staff of the board to manage? I think so. But when something goes wrong, and Diana's going to talk about this, all the ways things can go wrong in a minute, it can go very badly. And I think there are probably two root causes for what can lead to this going badly. The one is the information technology. It is old. It was built to support the Board of Nursing in the late 90s. And it no longer, I don't think, meets the needs of the board to process all these things as they currently do. And then the second root cause, I would say, is around customer service. And yes, a big part of that is just answering the telephones and being responsive to people. And this is not a perfect comparison, but if you can imagine doing business and your productivity, if you were using your computer from the 1990s and your phone from the 1990s, you might understand a little bit of what the Board of Nursing is dealing with or has been dealing with up until today. So with that, let me move to the next slide and turn it over to Diana.
Thanks, Mike. So I'm sure all of you were looking at that last slide and thinking, well, why am I getting so many phone calls? In our sample, so we took a sample of about 160 applications that came to the board, and we did find several instances where processing an application took a lot longer than what you saw on the previous slide. So there were 8 applications, for instance, where somebody was applying for their first RN or LPN license, and it took over 200 days to process. We learned there are many reasons why there might be a delay. Some of this is because of an applicant themselves. For instance, we found one applicant who submitted their application for licensure in March 2020, a great time, and they failed the NCLEX, which is the standardized exam that they're supposed to pass in order to qualify for licensure. And they did that 3 times before passing in October 2021. The board issued their license within 2 days of those scores being released. So in that case, it kind of fell on the applicant themselves. But there are other factors that can contribute to a delay in processing that do fall with the board. So one of these is the board's out-of-state education review process. Another is their criminal history record check process. The other is handling of paper applications and larger, more broad technology issues at the board. So I'm going to walk through a couple of these on the next slides. Thanks, Grant. So this first slide is just showing applicants for licensure who had to go through education program review. So any applicant for licensure who's educated out of state has to prove that their nursing education is substantially equivalent to what is offered in a Maryland school. They do this by having their education program submit documentation about the curriculum and course materials to the board's education team for review. The education program review can cause processing delays for these applicants if the board has not previously reviewed this education program. This primarily affects applicants coming from out of state for an endorsement license. So they've been already practicing as a nurse in another state, and they're trying to move their license to Maryland. We looked specifically in August of 2023 at 164 endorsement applicants, and a quarter of them required this type of review. Next slide, please. All applicants for initial licensure are also required to complete a fingerprint-based criminal history records check prior to obtaining a license. The board's background review team estimates that they receive anywhere from 500 to 800 of these reports in a single day, and they print all of them out and file them away while the applications are being reviewed. Applicants with a positive criminal history report then have to submit additional documentation to the board for review, including court records, a personal statement, character references. And if this all needs to be compiled and reviewed by the board, it can take over 100 days for that to happen. If they happen to report that they have a criminal history before the board finds out through the criminal history process, it can be faster. Next slide, please. And then the last piece of this is just the larger issue with the licensing software. So the board has 2 different licensing softwares that they use, one for the actual collection of license applications and the other for the management of the information about all active and past licenses. And on this slide, you'll see a lot of different reasons why those 2 systems aren't working. But we did want to mention that one of these, which is the My Licensing Office, is used by a lot of different boards of nursing and other health occupations boards throughout the state and the country. But most of them are using an updated software that has a web portal and a phone application and reporting tools. And we're still using one that was created in the early 2000s. So issues with the board's current licensing software certainly contribute on one end to confusion by applicants, but also internal delays in processing by the staff. Grant is going to take over from here.
So call volume at the Maryland Board of Nursing fluctuates. Staff must be logged into the system at their desk to receive phone calls. During the COVID pandemic timeframe, when many staff were working from home, the phone system showed that the average number of calls to the board was around 275 per month. OPEGA staff called the Board of Nursing main number 30 separate times during this evaluation to see if a human being could be reached while following various pathways of their phone system. 8 times out of the 30 calls, someone was reached. Switching gears to the Board of Nursing's Enforcement Division responsibilities. The board has received around 600 complaints against nurses annually for the past 3 years. In 2022, there were 628 complaints against nurses, which is down 38% from that recent peak in 2019, when there were just over 1,000. Complaints predominantly come from other state boards of nursing, long-term care facilities, hospitals, and patients. Complaints must go through the Board of Nursing triage process, where the triage committee, among other things, will assign a priority to the complaint for investigative purposes or decide that the complaint requires no further action. The average number of days between the date the Board of Nursing received a complaint and the date that the triage committee decided what action to take was 51 days. Complaints that were ultimately designated as priority 1, which is the highest priority, averaged 58 days before being triaged. The Board of Nursing staff are technically not permitted to begin investigations on those cases that eventually will receive a priority 1 designation, nor can they exercise their judgment to weed out cases with a high likelihood of receiving a recommendation to take no action. All of these complaints are in a figurative waiting room awaiting triage. Almost half the time, complaints receive a recommendation to take no action. Despite an aim to triage 60 to 80 complaints per meeting, between February 1st, 2020 and July 31st, 2023, the triage committee reviewed fewer than 40 complaints nearly half the time and only did more than 57 times. The Board of Nursing had an accumulated backlog of open complaints above 2,500 as of the end of 2022. Over 2/3 of those complaints had been open for over 3 years. The board closed an average of 560 cases from 2020 through 2022, and at that rate, it would take over 5 years to clear the backlog without any new complaints coming in. OPEGA sampled 78 complaints that got a priority number from the triage committee and have already received a board disposition to measure the number of days these complaints took to get through the investigation process. Those measurements are shown in the slide. Furthermore, it was found that complaints labeled priority 3, which is the lowest priority, by the triage committee ended in a board disposition of take no action 94% of the time. In comparison, complaints designated priority 1 by the triage committee ended with some form of action taken by the board 61% of the time. And I'm going to throw it back to Mike.
Yeah, last couple slides. And hopefully you've all seen this report. There's much more in it, in the 75-page report, I believe. But the vacancy rate. So the vacancy rate when we did this evaluation at the Board of Nursing was 20%. We compared that to some neighbors and then also some states that had boards of nursing that were similar to ours in the way that they're structured, or the number of professionals that they regulate. And Maryland's rate of 20% was higher than any of the other states and the District of Columbia that we took a look at. So the vacancy rate is an issue. On the next one, we just want to point out that they have a very low fund balance. The Board of Nursing is self-funded by fees for licenses and certificates. And when that fund balance is low, it becomes difficult to invest in something that may be a one-time expense, at least without the support of the legislature, the administration, perhaps the Department of Health. Next one, just want to point out Maryland's fees for licenses have not been raised or lowered since 2008. And this is where they compare to the other states in the country. I would say we're sort of in that part of the curve when it comes to what those fees are. But there certainly are states that charge less and states that charge more for their fees. And the last slide just shows some of the selected careful recommendations that we made that are in the report. I'm not going to go through all of them or any of them here. I'm happy to address those if we are asked to. But our understanding is that with the help of the health department, the Board of Nursing is already addressing some of the recommendations that we have made. And hopefully they'll have the opportunity to speak to that. So with that, I'm going to conclude. Thank you for your time. We're happy to take questions.
Thank you. Before, I usually just go to questions, but I want to thank you for the work that you have done. I know that our council has been keeping us informed, and we're very grateful for your work. Are there any questions for this panel? Delegate Kerr. My pleasure.
Thank you, Madam Chair. Thanks again. I know we're trying to look forward, but just help me understand why nothing was updated since the 90s?
Why the technology wasn't
Yeah,
updated
right.
since the 90s. I think they're in a better position to speak to that. I think I understand what some of the more recent issues have been, which is requests for support or perhaps for some support for funding that didn't happen, but I don't want to misspeak, Delegate. If they're not able to answer that to your satisfaction, I'll give it to you offline and see what I can do for you.
I have Delegate Lopez, followed by Delegate Johnson, then Delegate Taveras.
Thank you, Madam Speaker. I had a question about it. It's the slide isn't numbered, but it's this one. The 24% of folks that require the education review program review. Can you tell us a little bit of information about where these folks are coming from? Are these all folks from other states, or are these folks with an international education?
They are, so none of them are from Maryland. Do you remember, we have something in the report on which states we're getting the most applicants from who have to, and I can't remember if that's for the compact or for the program review.
It's both.
Our neighbors are one of those places. The issue with the program review is if there's a school that has a lot of graduates that end up coming to work in Maryland, they've already done the program review of that school. And so for a certain amount of time, we have confidence that that review is up to date. This person got the education and training that they need to practice here, and we're okay to move forward with their license. The issue becomes when somebody applies to be a nurse in Maryland, but the program that they completed had not been reviewed by Maryland ever or in a certain amount of time. And then they would have to go and see the curriculum from that school and all the rest of those things. And that slows down the process of licensing that nurse from out of state. Sure.
Delegate Johnson.
Thank you, Madam Chair, and thank you for the presentation today. I saw the funding steadily dropping. So does that correlate with the inability to process these licenses in a timely manner?
Sorry, you saw the funding dropping?
Yes, sir. Yes, I saw that the funding was less and less each year on one of the slides here. So, and since they operate on licensing fees, is that due to the inability to process these licenses in a timely manner?
I don't believe that anyone who had a delayed licensing, that many people whose licensing application is delayed somehow just bails out of the process of attempting to get a license. I think many of them stick with it for a long time to ultimately get that license, and that fee would be paid. So no, I don't think it has an impact on the overall revenue to the Board of Nursing.
Do you have any idea what's causing the drop revenue?
If there was a decrease in revenue, that would be because there were fewer people licensed or certified.
My pleasure. Delegate Taveras.
Thank you. I'm looking at Exhibit 4.12, and I see that Kansas has about 30 employees, while we have 90. So they have a third of the amount of employees, yet they're able to be, in essence, as efficient as we are. Can you attest the difference between why we're so behind? Is it that, compared to Kansas, are you aware what is that's making them so much more efficient than us?
Delegate, I want to understand your question. When you say that Kansas is more efficient.
Practitioners that in the number of practitioners that they
Sure.
regulate.
They have fewer staff per regulated practitioner. I don't know if you guys have any insight on that or if we address that in our report. I would only be speculating.
I think that when you look at other states, we're all set up differently. So the Board of Nursing, I can't speak to Kansas specifically, but I can speak to Virginia and DC. Those boards of nursing have a very different structure. Maybe they are funded differently. Maybe they have admin staff who are actually sourced through the departments of health or through, I think in DC's case, it's the Department of State. And so there are just very different ways of staffing boards of nursing in other states. I would also say that we have different types of practitioners in Maryland than would be regulated in other states. Again, I can't speak to Kansas specifically, but I know that the Maryland Board of Nursing regulates electrologists and med techs, and we also look at the different, there's so many different levels under that in terms of specialization that not all states have. And each specialization that you add on has a different requirement for licensure and certification. So,
sure, and there are different models in those different states. And so some of them, for example, are part of an umbrella organization of all the health occupation professions. And some of them have investigators that would do investigations for dental examiners, physicians, social workers, nurses. So they wouldn't be staffed to their board of nursing. They would be staffed to that umbrella organization. So it depends on which state.
Thank you. And usually I just allow one person to answer the question, so we don't go back and forth. I'm being a little bit flexible because of the amount of work you have done, and because the committee really needs the facts. I have and thank you so much.
Sure.
Delegate Collison, followed by Delegate Shalega.
Thank you, Madam Chair. So I think your primary job was to do the evaluation, but you did make some recommendations. So I'm wondering if you have any awareness of a plan to update the technological systems so that they are better integrated and for both applicants and staff.
I believe they're in the process of doing that now. I also believe they got an appropriation a year or 2 years ago to be able to at least start scoping out that work. I don't know if that's part of the major IT project development fund or how that was done. I think they're probably going to be able to clarify that for you, Madam Vice Chair. But my understanding is that they are moving forward.
Great, thank you.
Sure.
I have Delegate Gazzoni.
Thank you, Madam Chair. I was following up a little bit on Delegate Taveras' question and actually Delegate Collison's. Would you expect with improved IT system that our number of employees and sort of you have the column that says regulated practitioners per employees, that would become stronger because we're clearly less than that in the other states that you looked at?
I think the effort that it takes on the staff of the Board of Nursing to do things like create separate databases to link what they're doing in one system and what they're doing in another system, or for them to literally print out and file and later shred every background check that comes in because they can't complete it within, I think, the 90 days that it's available online. And so to make sure they don't lose it, they print it, store it, later shred it. I believe there are a lot of efficiencies there that if they had a system that met their work processes, that there would be a lot of other things that they could spend their time on that they're not able to now because of the extra things they have to do.
I have Delegate Woods, followed by Delegate Alston.
Thank you, Madam Chair. My question goes back to your statements as it relates to people getting their licensure.
Mhm.
And so I actually had a situation where a constituent received her associate in licensing from Rain College in DC prior to their closing. They were accredited at the time that she received her licensure. She went on to get a degree from Howard University in nursing. However, they are refusing her licensure because they're saying because Rain closed and is no longer considered accredited, she can't get her license, even though she's gotten the bachelor's degree in nursing from Howard. She's passed her NCLEX, she's done all of the appropriate things. How do you address something like that, where it looks like has all of her ducks in order, but she is still being denied a licensure because they're saying anything that comes from Rain, even though they were considered accredited and acknowledged as accredited?
So, and if we addressed this in the report, we were careful with it, but there is an argument, I think, to be made that if a program was accredited at the time somebody completed it, that could be enough. And that the independent program review that Maryland does, not every state does that. There are like 3 accrediting bodies, national ones, and they could accept that accreditation. Maryland has chosen to go further than that and make sure that every individual program that we consider licensing someone from is reviewed by us. And it leads to issues like your constituents have.
Okay, thank you. You have a follow-up? Go ahead.
What do you recommend how do I direct this constituent because she is still having this challenge?
I would direct them to Executive Director Rhonda Scott. And I know where to find her. I know where to find her.
Thank you very much.
Sure.
We have Delegate Olston, followed by Delegate Hill.
Thank you, Madam Chair. First up, if it's okay, can I start with a compliment?
Sure.
Okay. So a few months ago, I had to reach out because I had a constituent whose license wasn't updated. And because that license wasn't updated, they actually had a write-up from another part of the Department of Health, and it was due to the backlog. So that was very concerning, but I was able to reach out to the Secretary's office, and you all did a great job getting it updated right away and taking care of the write-up. So I know it's been a challenge taking this board over, but I think that you all are doing great. That said, I do have a concern about the almost 50% drop in the number of certified medication technicians and nursing assistants that's on, I believe, your first slide. Can you tell me what may be accounting for that? And is this leading to some of the difficulties we're having with getting more people in the industry and dealing with staffing concerns like at the hospital and shortages? Could this be filling a void? And why is there such a drastic drop?
Delegate, it's a great question. And I don't want to, I think that the health department or the Board of Nursing probably has better information on that than I do.
And they're next.
Yeah, and they're up next. So
Yeah.
I don't want to give the wrong answer when the right answer is literally sitting behind me.
And I appreciate that. Thank you so much. We have Delegate Hill, followed by Delegate White.
Thank you very much for your evaluation and your presentation. I was looking at the slides and at the report, and a lot of the recommendations seem to be about staffing and technology. What I'm wondering about, and you kind of mentioned it a little bit in the earlier question, answer to Delegate Wood's question, what about processes? So you mentioned that we're doing additional background checks or additional education checks when some of these institutions, it should just be, they belong here, they're certified, we assume these are valid degrees. And, you know, are there other inefficiencies? I don't know if the criminal background checks are taking longer than they should, or how many are refused. Do you have any recommendations of that, particularly in light of the fact that the nursing board also had problems very recently with having given out licenses that turned out to be to institutions that weren't valid institutions?
Sure. The program review process, as you point out, is one of those that they could choose to not do, which many other states will simply accept the accreditation of a national accrediting body. I think that first recommendation on the slide is that participate in this program called Wrap Back, which the state runs, which basically maintains someone's criminal history. So you don't need to get them fingerprinted and do all that stuff again. Once they've done it once, if you want to recheck it 3 years later, you can go do that automatically. That exists, and they could start doing that when they choose to do it through, I believe, the Department of Public Safety and Correctional Services. And let me just, it's a great question, Delegate, and I want to think if there's anything. I mean, we sort of hint at this, I think, in the report, but let me say something about the board in the 14 members that make up that board as opposed to the staff of the office. They're volunteers. They are either a lot is asked of them or they ask a lot of themselves. They are very in the weeds on many of the things that happen at the sort of staff level, especially when it comes to the complaints. And they're unpaid. And I believe they're also in most cases required to be a professional licensed by the board. And I believe to maintain that license, you have to continue to be practicing. So these are part-time volunteer unpaid positions that we are asking. I don't say we meaning the legislature. I don't say we meaning me. I mean, whatever is asked of them, it's a lot. And could some of those things, we have some recommendations to delegate some of those triage decisions to staff. Could they do that? I think they could. And that way, if there is a really concerning complaint that comes in, you could expedite that to get it looked at rather than waiting 60 days, 90 days for anyone to even take a look at it. Or if you see a complaint that 95% of the time never ends up in any action, you can sort of dismiss that, reduce your backlog and focus on the things that are important. So there are things like that in our report that I think hopefully are helpful to them and helpful to you as you try and support them.
Sure. Thank you. That was helpful. So one follow-up is any part of your recommendation that we ought to consider splitting the board, or do they have too many licenses that they oversee? Or is it really about how they organize themselves and whether they're in panels that are doing different work and overlapping? Is it organizational or do we have too many things for a single board to be handling?
They have I think both probably. I mean, I think they could simplify the structure. They have many subcommittees that are, again, very involved in a lot of these things. So they could both simplify that structure as well as choose to not be as involved as they are.
Delegate White, followed by Delegate Rosenberg. Thank you, Madam Chair, and thank you all for your presentation and the comprehensive report. Going back to the recommendation as it relates to the study of the fee structure, I wanted to know when was the last time our state did an analysis of this and how frequent or what is the frequency of us conducting this type of review of our fee structure?
I'm not sure the last time. It's set by in COMAR. It's a regulation that can be changed through the regulation promulgation, I'm not a lawyer, process. And I can certainly see arguments for why you'd want to keep that fee low. I don't think you want to deter people from entering the profession or staying in the profession. On the other hand, prices have changed, costs have changed, salaries have changed since 2008, and I could see an argument for increasing those so that the board could invest in itself, because that's the only way, other than some sort of special appropriation, that they could invest in themselves.
You're welcome. Thank you. Thank you for being patient, by the way.
Oh,
really
sure.
appreciate it. We have Delegate Rosenberg.
Thank you, Madam Chair. I believe you talked about additional personnel needs and you recommended that. Has that been if that is the case, has that been passed on? Who makes that? Who's responsible for trying to get that into the supplemental budget?
As far as the budget process, I'm not sure, but usually that is a communication between the board, the health department, and the Department of Budget and Management. And part of the complexity of what the Board of Nursing has to deal with is the fact that I believe their HR and personnel and hiring is dependent on the health department. they don't work for the health department. They work for, and a 14-member board that's appointed by the governor and confirmed by the Senate. So when they have the support of the health department, that's very good for them. And when they don't, sometimes that sort of ties their hands. They have sort of accountability without full autonomy over their operations.
Seeing no other questions, I want to thank you on behalf of our committee for your work. Thank you for coming today and for being so patient as we ask these questions.
Thank
We
you.
really appreciate each and every one of you. Have a
Thank
blessed
you.
day. Next, we have the Maryland Department of Health. We have the Secretary, Laura Herrera Scott. We have Rhonda Scott with the Executive Director of the Maryland Board of Nursing, and we have Aaron McMillan, who's the RN and Chief of Staff for the Maryland Department of Health. Good afternoon, Madam Secretary. How are you?
Good. How are you, Madam
Good.
Chair?
No time. We have to stop seeing each other this often.
Yes, we do. Good afternoon, Madam Chair. Members of the committee, I'm here today to provide an update on the Board of Nursing and the work that we've been doing collaboratively. But first and foremost, I want to introduce you to Rhonda Scott, who is now the Executive Director of the Board of Nursing. And just to tell you a little bit about Rhonda, she is a trained nurse graduating from Coppin State. I won't say when, but graduating from Coppin State with honors, including the Coppin Eagle Award, which was for having the highest GPA of RNs transitioning to BS. And then she went on to get her law degree from Baltimore School of Law. She has a long distinguished career, including, working as a nurse, but more recently was the Deputy Director for the Board of Nursing from 2019 to 2023. And then in May, during the transition, graciously agreed to step in as the acting Executive Director. And after working with Rhonda for several months, myself and Chief of Staff Aaron McMullen, we formally appointed her into the role in September of 2023, and she's been absolutely a wonderful partner. I think you'll also see from the presentation just what a collaborative partnership this has been and all the work that we've been doing together. And I certainly would be remiss if I didn't thank this committee for all the work in not only passing this legislation, but then allowing us to work together to address the needs of the Board of Nursing. So thank you. Next slide. So since signing HB 611, State Board of Nursing and Sunset Extension, we've been pretty busy and have made significant progress in several primary areas, both of which have been identified by 2 independent evaluations. So the rest of the presentation will focus on these 5 areas: constituent services and communications, technology and application processing, fiscal responsibility, complaint response and investigation, and staffing. And we hope by providing the update, it'll address some of the questions that you all just had. In addition to the work that in these groups, we have been partnering with not only the independent evaluation, but the results of APEGA to develop a checklist, for lack of a better description, to start moving the work forward. So the first thing we did as a charge of the bill was to release an RFP requesting an independent evaluator to assess the Board of Nursing. We posted a competitive emergency procurement for the independent evaluation and received 1 bid, and that bid was from Ernst & Young. We had asked that they include examples of prior experience working with health occupation entities and administrative workflow improvement. And the way we came up with the requirements for the RFP, even before the bill passed, myself, Chief of Staff Aaron McMullen, and our board liaison went to the board and did what I would call speed dating, for lack of a better description. We met with every single employee of the board separately, and then we met collectively to group what we heard. And there were recurring themes that informed the RFP, which were the buckets that I defined. So we took their reports, which not only detailed areas of opportunity, provided suggestions for long-term and short-term gains, and that report was delivered to the General Assembly on 9/1. In addition, we also had the independent evaluation from OPEGA, and we certainly want to thank OPEGA for their detailed evaluation of the board, which just solidified and augmented what we had learned. I also want to say we did a crosswalk of the Ernst & Young and OPEGA evaluation because we wanted to see, are we all coming up with the same things? And we did, with some nuances to what the report said, but I think the biggest difference was internally facing, externally facing. As we heard from OPEGA, they were not only just thinking about the board and its processes, but what the impact was to the licensees and the other constituents that they served. So OPEGA conducted a stakeholder analysis that led the focus and efficiency and effectiveness of the areas that you heard: licensing processes and renewal of licensees, complaint investigation processes, and the general management of the office. Their final report was published in December 2023. And again, we took that report, crosswalked it with EY and what we had been doing to really tee up what you're going to hear from us today. I will also add that OPEGA solicited direct feedback from customers of the Board of Nursing, which really provided insights into other areas that maybe weren't captured in the EY report. So with that, I would like to turn it over to Rhonda Scott. We're going to start with constituent services and communications.
Thank you, and good afternoon. Congratulations.
Thank you, Madam Chair. Thank you. Good afternoon to the committee. I appreciate the opportunity to be here and talk about all the great work we've been doing. Next slide. So what we've been able to do is we've been able to drastically reduce the number of open constituent cases, as you can see by the slide, from where we started and where we ended last year, and as of today, we are still have 0 open cases. So we've been able to close cases earlier and get back to our constituents in a much shorter time frame than we previously were able to. Next slide, please. In addition, we we're able to acquire additional telephone lines to help decrease the wait time and the drop calls. And in addition, we've been able to bring on more staff, which would, we recognize that we need staff to actually answer the calls, which we've been able to do. So we're still working with the department on updating systems and bringing on more staff, but we have been able to certainly decrease the number of drop calls and wait times as well. We're also working with the MDH's communications office to address immediate concerns, and including updating our website, which we recognize that too will be a mechanism for less constituent concerns and complaints, because there's more direction on the website for our constituents.
Thanks, Rhonda. And for the record, my name is Erin McMullen. I'm Chief of Staff at the Maryland Department of Health and also a registered nurse. I'm going to spend a little bit of time going a little deeper on the technology issues that DLS highlighted in their presentation. So, over the past 8 months, the department has worked really closely with the board, and we've developed a strong partnership with a shared vision of really modernizing the Board of Nursing. Foundational to that goal was actually reconnecting the board. So you probably all remember that in December of 2021, there was a major network security incident that affected the department as well as the board. The board remained unconnected until recently. So since this bill, House Bill 611, was signed, through our Office of Enterprise Technology at the Department of Health, we reconnected the board to MDH's network by the close of fiscal 23. So I really can't underscore how important this was, not just to improve the security of the information held by the board, but really to improve efficiency. I think OPEGA highlighted clearly like the systems limitations that the board has. But the reconnection was also necessary to address findings identified by the independent evaluators, both Ernst & Young, but also DLS. That includes migrating the board's licensing database to a new secure server, which we were able to do earlier this month. And it's also needed to help make the needed changes to the board's website. We're working with them to move their website to MDH's server, but also our communications team can assist with updating that website. So another area identified by both OPEGA, but also Ernst & Young really does relate to the board's licensure system. And as highlighted previously, right now the board has kind of two parts to this system, which require staff to manually transfer data between the two systems. So the first component of that, that's the public facing website for nurses, is the licensing application retrieval system, or LARS. That's your public facing website. It's not what I would necessarily call user friendly. You can't, when you log in, you can't see if there are certain things that are missing from your application. The only way to do that would be to call the Board of Nursing and see if there's a part of your application that is pending. So we've extended that system as a stopgap, and I'll talk a little bit more about what we're hoping to do in terms of the future IT infrastructure of the board. But then the second component is this backend system, which the board has to kind of manually transfer data to. Ultimately, I know that's inefficient, but I want to just highlight too that that's an opportunity for error, right? Anytime you're touching something and moving it somewhere else manually, that's an opportunity to create more inefficiencies in the system. So as was mentioned earlier by DLS, we do have a major IT development project, or MITDP, to implement a new licensure system for the board. And I just want to underscore, the Board of Nursing licenses over half of all health occupations in this state. That's inclusive of nurses, certified nursing assistants, et cetera. But this updating their system is really a key step in modernizing what we're doing with health occupations in our state. And our hope for a new system is really twofold. So first, it would serve as that end-to-end licensure system for the board. It would eliminate the need to have these two separate systems that I described on the previous slide. But we also hope that it can give us the back-end data that's really necessary to plan for the healthcare needs of Maryland. So that would include things like demographic data and like what setting a nurse works in. Well, I think I use my nursing education daily in this job. I am certainly not providing direct care. If you look me up on the Board of Nursing's website, that's not information that's available. I'm counted in the total number of nurses that's licensed by the board. And as we saw with the pandemic, really knowing what our nursing workforce looks like is so important. It's also really important to help us plan for the future. I would also just say that it's really our hope that this new system can serve as a vehicle for other boards in future years. Although the MITDP was funded in prior years, work to procure a new system really hasn't started in earnest until last year. Just want to thank the committee, because House Bill 611 really did serve as a catalyst for the board and the department to work together much more closely. That includes leveraging resources in our Office of Enterprise Technology. And our CIO has been able to work much more closely with Rhonda, with the team at nursing, to begin developing those business requirements for a new licensure system. I would say historically, this type of proactive engagement hasn't been there. The department kind of responds on the back end when the boards are working on these types of big projects. So I'm not going to go through the individual recommendations listed here. Just want to underscore that many of them are dependent upon us getting a new IT infrastructure, new licensure system for the board through our MITDP. Those recommendations continue on to the next slide. The only thing I would highlight is the third item on this chart, which relates to the review of educational institutions. That was, came up earlier, but I can say that the board has been working to look at those non-Maryland based schools and really thinking about how we do that more broadly. And with that, I will hand it back over to Rhonda.
Thank you, Erin. So yeah, Erin did mention the partnership, and I can honestly say working as closely as I have with the department over these last few months has been amazing. And it is really, the pinnacle of why we're able to do what we're able to do with this partnership. And, the fiscal piece of it, I know it was mentioned about the fees. And so what we're currently doing is we're looking at licensing fees nationally to determine what our fee structure should look like. And the budget office at MDH is actually, we're working with a budget analyst to assist us with that process. And so we anticipate that we will have a fee structure published, because this is in regulation, by the summer. As far as, next slide, please. Thank you. Yeah, you can go to the next slide. Thank you. Thank you. Additionally, with the complaint process, so we are in the process of onboarding new non-nurse investigators to assist with processing complaints and the backlog. We've already acquired 7 that we made offers to, and we already have developed a plan to address the backlog and the processing of complaints. Once the team members come on board, we can implement that plan quickly enough where we can get on board with addressing these complaints. We were approved for 10 contractual non-nurse positions. Like I said, we made 7 offers and we reposted the other 3, but we have that plan in place to address this once these folks are onboarded. Yeah.
All right, and then just to close out the formal portion of our presentation today, we just wanted to highlight a few strides related to staffing. Making a leadership change at the board and appointing Rhonda as the executive director was really a key step since House Bill 611 was signed. Prior to the bill's enactment, the secretary mentioned earlier that we went out to the board, but prior to its bill signing, secretary didn't have authority over the board, and this bill really allowed us to partner in different ways around infrastructure and operations that we hadn't been able to previously. The other recommendations that are identified by both OPEGA, but also Ernst & Young, do require further partnership with the department, but also the Department of Budget and Management. There's recommendations on this slide and then also the next slide where that level of collaboration is really going to be needed. And I think it's really what we're trying to do with support from the budget and management office at the department is really make sure we're planning for what the board needs in the future. There's been a lot of questions around what the staffing structure should look like if they have, based on this current system they have, but hopefully how the board is staffed with a new and improved system can look much differently. Ultimately, MDH really does agree that the hiring practices and employee retention should be reviewed at the board. And we're really trying to do that, not just at the board, but MDH more broadly and really think of this in a holistic way. That concludes the former part of our presentation, but we do have some updates here just around appointments for new board members. We do, OPEGA mentioned earlier that there are volunteer board members that sit on the board. 10 out of 14 of those board members have been appointed. Recruitment is underway for the other 4. And the department's also really taken a different approach to employee engagement. The secretary holds regular town halls. We've been out to the board on more than one occasion to meet with staff. Rhonda meets with the team out at Board of Nursing quite regularly to improve communication. That does conclude our presentation, but we're happy to take any questions, Madam Chair.
Thank you. And I want to thank the secretary and the entire panel for your work on this. I know that it was a mess, right? And we're trying to clean it up. And many of us received complaints from our constituents and especially during these times. So we really appreciate your work and your efforts. I'm going to start to my left. I have Delegate Chisholm, followed by Delegate Lewis, followed by Delegate Hill.
Thank you, Madam
My
Chair.
pleasure.
We received a letter back in December from System Automation. And I guess they handle one half of this equation, which is my LO. Are we moving away from them? And I ask that question because if we're looking to upgrade the technology and the software, it doesn't matter how many people we actually hire. We could hire 500 new people. If you don't have the technology to move us forward, then it's immaterial, in my opinion. Because you can put Michael Andretti in a Chevy, it's still a Chevy. You need to be able to have the correct vehicle to get us there. So with that being said, do we have a price tag and do we have a timeline on when we're going to be able to incorporate the new software or the new system and what's it going to cost and able to be able to put that into place?
So I'll start. We are
working with the board on getting the business requirements for the licensing software. There are several off-the-shelf products, and that's certainly our preference as opposed to a new build, which takes takes longer and is often just way more expensive than it needs to be. So we're looking at the off-the-shelf products based on the business requirements. So, but I also have expectations for what I want this software to do, not only to the point that was mentioned about efficiency and moving data from one system to another. But I'm going to give you a very silly analogy, but I love it. And this is what we're striving for. I don't know how many people here have ever ordered pizza from Domino's, right? You know, when the order hits, you know, when your pizza's in the oven, you know, when it's getting boxed, and you know, when it's on its way and when it's at your front door. A nurse should be able to track her license from the time that they submit that license to know where it is. And if information is missing, they should know that electronically. So then they can queue up the system to then be able to find their license and know who to call. That's what we're trying to build as part of the end-to-end solution. On the back end, as Aaron already highlighted, we're also very keen on knowing who our workforce is, not only for all the reasons we said, whether there's another pandemic or something else, but knowing where they work, who they work for, what their hours. But I'm also looking at cultural proficiency, other languages spoken, other things. So that's also going to be part of the new licensing system. So we're close on the business requirements. It'll be a formal competitive RFP that'll hit the street, hopefully by summer, with a new system planning for 2025. We do have to maintain the systems that we have, though, for now, until we get the new licensing software on, live.
Thank you. Delegate Chisholm, he cannot use my Honda Fit to race. Just saying. Delegate Lewis.
Thank you, Madam Chair. Thank you, Secretary Herrera and your team. Can I just also add my voice to the thanks to all of you? It's so nice to have a secretary who's a partner and a leader, who brings on a team of experts who care about the people of Maryland. I cannot tell you, my PTSD is healed.
That might be another session.
But thanks again. My question is, I was made such a good joke, I've forgotten my question. It was every now and then, every session I get one. It had to do with, the board and governance. So you mentioned that you're in the process of filling all the board seats and that there are 4 remaining. I'm curious what because part of running an organization like the Board of Nursing is governance, and that's what the board's meant to do. And I think, with gratitude to all the good folks who volunteered their time to serve on the Board of Nursing in the past, I'm wondering if what we're looking for in new board members, how you're identifying those candidates, and what your expectations are for their performance.
Who's the best person to answer that question?
I'm happy to.
Sure.
Well, I can.
Yeah, go for it.
Well, one of the things we want is a board that is open, understands the issues, understands what their role is as a board member, and knowing that although our mission is public protection, we also have to balance that with the workforce shortage and what's best for our constituents and the citizens of Maryland overall, and how important that is to how important their decisions that they make and the issues that they preside over are at addressing these concerns.
Thank you. I have Delegate Hill, followed by Bagnall, and then Delegate Kerr. My pleasure.
Director Scott.
Thank you.
Thank you, Madam Secretary. Assistant, thank you. So sort of 3 parts. Number 1, we had in the early report that there was a backlog of 2808 complaints. The page 7 of your presentation talks about resolving the backlog of cases, and you're talking about total number of overdue cases as of December being down to 0. Are we talking about different things? So that's one part, yeah.
Can you
is-
allow her to answer for a second, please? 1
Okay.
minute. Will you please address that?
One is the actual complaints against nurses or one of the licensees / certifications. The table we showed you was constituent reports. So complaints that we get from constituents that call to the department and what our time was to resolution. So one is an investigation by the board and one requires follow-up from MDH through and the board through constituent services. So they're two different reporting structures, but unfortunately both related to complaints.
Different types. Okay, thank you. The second part goes to that. The metric used in this, at least on the slides, was complaints received to the time for triage, but I didn't see a number about to resolution. So triaging is one thing, right? It's getting to the right people to handle, but I'm not clear. Do we have numbers about how long it takes for the things that are triaged to actually get resolved?
So we can provide an updated report. We track that for all the boards and we track it within the health department, within the administrations, and I get a weekly report of every single complaint and its age. And it's less than 10 days, 11 days to 30 days, and then greater than 30 days, greater than 90. So I can get back to you, or we can provide that in a written response to the commission if that's okay.
Sending out the new RFP and looking at new technology. One of the things I've noticed on the, not nursing, but the websites that I'm on for the Department of Health is that when there are things that are wrong and we're being sent to links that don't exist, we can go to 24-hour tech support, but they don't seem to have any authority to pass those complaints back to the department so things can get fixed. So if the people we get to talk to are tech support, there seems like there ought to be a way for them to hear what we say is wrong and get it back so that the next time I go on the website, I'm not dealing with the same links that don't work.
So we agree. We have a very clunky website writ large, not unique to the Board of Nursing, but MDH, under the leadership of Assistant Secretary Marie Grant, who oversees our communications team. We are actively looking at retooling our website, especially getting all the old information off the website, including links that go nowhere. And then I think you're familiar with Secretary Savage has brought in a new leadership team, one of which is a content website expert. And we've already outreached her, had a preliminary discussion of places where she will start helping us improve and clean up our website. So that is work underway for MDH proper, but also specifically for the board.
Thank you. Delegate Bagnall, followed by Delegate Kurt, and then Delegate Olston.
Thank you, Madam Chair, and thank you very much for this presentation and for all your hard work. And actually, I think I have a follow-on question to Delegate Hill. Just circling back to the efforts for IT. We know that we want to have a product that meets the needs of the board. But there's also a question of, are we bringing the oversight, the management more in-house rather than having it under the auspices of an outsourced vendor?
For the software? So again, I mean, the software products that we're looking at right now are, potentially off the shelf products, because the time to build something we think would take too long, and quite frankly, those kind of projects often run over budget and not delivered on time. So we are looking at off the shelf products, and there are multiple licensing software platforms. So we've looked to our neighboring states, and you heard Opega talk about even Milo, which we only have an old piece of, which has an end-to-end solution, but we are, again, defining the business requirements. So we would need ongoing support from the vendor that we get the software from, but the goal is that the Board of Nursing would be able to run the reports that it needs to report and do itself. That would be part of the software, the ability to just run our own reports so we can answer questions based on the kinds of things that we want to know about our workforce moving forward.
And to our members, it is now 2:05. We're supposed to start the next topic at 2 p.m. So please stick to one question. Thank you. We have Delegate Kerr, followed by Delegate Alston, and then the last question, Delegate Rosenberg.
Thank you, Madam Chair. Madam Secretary, Madam Executive Director. The antiquated software system, I'm asking you to speculate here, I understand. Did it contribute to your lack of retention and the vacancies? People were frustrated with their inability to do their job effectively. And do you anticipate that a new system will increase productivity to the point where some of those vacant positions will not be such an issue?
Well, I can't really speak to whether it contributed to the vacancies, but I can honestly state that yes, it will definitely improve our abilities to, license people better and staff productivity and certainly morale, right? Because there's less manual frustrating, pieces to it. You're welcome.
Delegate Alston.
Thank you. And if you don't have the information, if you could get it back to us, but my question is the same from earlier. Can you explain the more than 50% drop in people applying for the licenses of, I think it was med techs and CNAs, and what, if any, effect is that having on our nursing population?
Yes, we actually pulled that report up while you were talking. It's exhibit 2.4, so I know by heart already. So we'd like to go back and work with Opega to understand the data pull and the timing of the data pull. Not sure if it's a data issue, if it's a real issue. There could be a lot of reasons, but we'd like to respond to you in writing on that one.
Thank you. And when you get back to us, if you could just copy the entire committee, okay? Thank you. Delegate Rosenberg, you have the last question.
Thank you, Madam Chair. It's the same question I asked before. Can you speak to us? I know these are budget decision-making, or what's the process, or what do you expect to do regarding the recommendation for more staff in the current budget year?
So we are, we're working, like I said, closely with the department, and they're assisting us with, infrastructure costs. But we also are looking at, the plan to raise the fees and to make sure that we're going to be budgeted to bring on the staff that we need moving forward to maintain board processes and operations and things like that.
Thank you. Thank you so much. I noticed that there are some recommendations that will require someone from our committee to introduce a bill. If you will be so kind, feel free to contact any of the members and ask them, would they consider putting in that bill? All right, and one in particular regarding that the requirement of not being a nurse. If you would do that, that would be great, okay? I think some of them still have capacity, so they'll be able to do it. I want to thank you for all your efforts. I know that this is not easy. I can see all the work that you're doing and the collaboration, which is beautiful to see. If there's anything that we can do to make your life easier, or any help that you need while we're here for the next 88 days or whatever that is, let us know.
84.
84, okay, wonderful. Counting. Well, I really appreciate that, okay? And thank you for everything. You have a blessed day.
Thank
Thank you. I want to bring up the next panel, and I want to thank you. I know it's 2:09. We're 9 minutes behind, but we'll make it up to you. Will you be so kind and come in the order I call you? And will you be so kind and bring 3 additional chairs as well? I'm going to do this in this manner because I think everything is connected. So I have first the Governor Office of Small Minority and Women Business Affairs. I have Special Secretary Yolanda Maria Martinez, followed by Ms. Nichelle Johnson. And then I have the Maryland Department of Transportation. We have former Delegate Tony Bridges, welcome, who's the Assistant Secretary of Transportation, Equity and Engagement, with Jen Walker Imigo, the Director of MDOT's MBE office. And then the Department of General Services. I have the Acting Deputy Chief Procurement Officer, Jamie Tomaszewski, and then Wallace Sermons, the Deputy Chief Procurement Officer, Office of State Procurement. Can you bring 3 chairs, please? And just put them around the desk, please. Thank you. And you can put on the other side as well, put another one to your right. Thank you very much for being flexible. Thank you for your patience while we finish the last panel. So we're going to start, good afternoon. We're going to start with Special Secretary Yolanda Maria Martinez. Welcome to the Health and Government Operations Committee.
Thank you so much, Madam Chair, Vice Chair, and members, esteemed members of the Health Government Operations Committee. My name is Yolanda Maria Martinez. I go by Maria, and I have the honor of serving as the Special Secretary for the Governor's Office of Small Minority and Women Business Affairs. It is truly a joy to be here, a pleasure. I do appreciate this opportunity. Today, I'm joined with key members of our team who will assist in providing comprehensive responses to any questions you may have. While I've been on the job for 7 months and feel very confident. I brought these individuals who really have a lot of the subject matter expertise. So should you have any additional questions, Pam Gregory, our Chief of Staff, Davon Gardner, Director of Policy and Legislative Affairs. Thank you so much. And I'm delighted to introduce Nichelle Johnson, who is our newly appointed MBE Ombudsman. We are here to offer full support and look forward to working with you with this important work that we do. In collaboration with our colleagues from the Department of General Services and the Maryland Department of Transportation, Office of Minority Business Enterprise, we prepared a Maryland socioeconomic program overview procurement presentation, and each team will present their portion of the presentation. So again, thank you for this opportunity. GOSBA, as we're affectionately known, the Governor's Office of Small Minority and Women Business Affairs. We are a team of 11 passionate and committed professionals. This team has been absolutely critical and invaluable in the continuity of the work that we do, and also in the work that we are embarking on. Our goals are to support the liaisons and procurement officers to successfully implement the socioeconomic procurement programs at the agency and department level. We help vendors compete with confidence in the state contracting arena, connect all small businesses to state, local, and federal resources. The liaisons within the agencies, there's 73 agencies and departments participating in the MBE program, and they're required to staff an MBE liaison. Currently, 69 positions are filled, and there are 4 vacancies. GOSBA circulates a compliance bulletin every month and meets with liaison 8 times a year. 2 statewide training sessions, 4 quarterly compliance calls, and 2 liaison onboarding training. One-on-one meetings are held upon request. Our MBE compliance managers hold about 60 one-on-one meetings a year. So our fiscal year 2023 annual report was released last Friday, and we're very excited. It was due this today, and it was done and completed on Friday. So that accomplishment, I credit the entire team. They worked through the holidays to ensure that we had the timely commitment was met and that we were able to provide that information. While the 3 programs missed their target, we are seeing growth in the number of certified small minority women and veteran-owned businesses in our vendor pool. Increasing the vendor pool makes and leads to more robust goal setting and is an important first step in fulfilling the promise of opportunity and economic equity within Maryland's procurement system. Next slide, please. Thank you. Governor Moore issued the first ever MBE-related executive order at the onset of his administration. We learned that only 24% of the solicitations issued from July 1, 2022 through February 16, 2023 included MBE goals. We can and we must do better. We are already taking actions to improve goal setting. Next, thank you. We also learned that outreach and marketing efforts by participating agencies and departments must improve, and we have to provide resources for vendors to understand how to do business with each agency.
We believe increasing the pool of certified vendors is critically important and have developed several key strategies. Next, please. Earlier today, Governor Westmore announced the appointment of Nichelle Johnson to serve as Maryland's first MBE ombudsman in the Governor's Office of Small Minority and Women Business Affairs. Nichelle has been on the GOSBA team for over 4 years and has a 20-year record of helping entrepreneurs in the private sector. She's an invaluable member of our team and is eager and anxious to serve in this new role and help grow a more equitable economy. The MBE's duties are outlined in the statutes. Nichelle's experience as an MBE compliance manager, along with her passion for coaching small business owners, makes her uniquely qualified for this role. She already has established relationships with the MBE liaisons and procurement officers and has been actively involved in advocacy issues throughout her tenure at GOSBA. Doing business with the state of Maryland is very different from working in the public sector for MBEs or certified MBEs. I want to take a moment to highlight just a few of these key differentiators. Everything we are buying over $15,000 is publicly advertised on the MBE Marketplace Advantage. We evaluate for MBE goals on contracts over 100,000, and there must be a pre-bid meeting on these solicitations so MBEs have the opportunity to connect with potential prime bidders. MBEs performing as prime contractors may fulfill up to 50% of the overall MBE goal. And MBEs with dual certifications can meet multiple sub-goals on the same contract. A really unique characteristic is that the prime contractor must name the MBE and cannot remove that firm without written consent of the agency head. 30% of all awards in fiscal year 2023 were made to MBE prime contractors who have a legal contract with the state of Maryland. 70% of the work performed by the MBE community is at a subcontractor level. In order to be successful, our MBEs need to build strong relationships directly with the prime contractors and how to basics of navigating state procurement. Everyone on our team understands that small minority-owned businesses often have fewer resources than larger competitors. I want to assure you that we work very hard so that the MBE primes and MBE subcontractors have access to a wide range of resources to help them compete with confidence. The next few slides are the statutes and regulations for all 3 socioeconomic procurement programs, which I thought might be a useful reference in the future. You see there for the MBE, for the VSBE, and for the SBR program. I would like to turn the program over to Tony Bridges, Assistant Secretary for Transportation, Equity, and Engagement with the Maryland Department of Transportation.
And what we're going to do for the committee, we'll let the 3 programs give their presentations. So then we'll ask the questions. So make sure you're taking notes so we can come back. Thank you so much for your presentation.
Thank you.
Good afternoon.
Good afternoon, Madam Chair. Thank you, Special Secretary. Good afternoon, Madam Chair, Vice Chair, members of the committee. For the record, Delegate, Assistant Secretary for Transportation, Equity, and Engagement, Tony Bridges from the Maryland Department of Transportation.
Always a delegate, like you just want to come back. That's what it is. Go ahead.
It's so, I'm not used to not being on this side and talking about a bill and talking about an agency instead. So, but I'm really excited to talk about this agency, the Maryland Department of Transportation, and the work that we do. Just for the record, I'd also like to introduce some members of the team who are here to answer questions if I can't answer any, who also in some form or another help us with the Minority Business Enterprise Program and the participation. Those members, if they could raise their hand or just stand so that you know who they are. Tracy Watkins Rhodes, who is the Director of our Office of Equity and Diversity. Chantel Kai Lewis, who is the Director of our Office of Minority Business Policy. Valerie Radomski, who is our Chief Procurement Officer for MDOT, Kim Johnson, who is our Chief Equity Officer, and the person you'll hear from in a second, Jan Walker Myogo, who's the Director of our Office of Minority Business Enterprise, which is a certification office. If you go to the next slide. I just wanted to start off by giving you just a big picture about the Office of Minority Business Enterprise and the work we do as a certification office for the state of Maryland. Within that office, we are the ones that bring those businesses into the certification process. And so we have 4 different areas that we certify those businesses on. That's the Minority Business Enterprise Program, which is all the state procurements. Then you have the Disadvantaged Business Enterprise Program, which is really for the federal procurements under the U.S. Department of Transportation. The Airport Concessions Disadvantaged Business Enterprise Program, or ACDBE, you know, we got a number of acronyms, which is really for the airport concessions. And of course, the Small Business Enterprise Program, which is for those non-race-based programs that are just small businesses. And what we do within the Office of Minority Business Enterprise is make sure that we're bringing those businesses in and doing our due diligence to make sure that they are who they say that they are. Which Jan is going to talk about, but we really try to make sure that those certified firms meet all the eligibility standards to become part of our program. I'm happy to say that we have over 9,300 certified minority businesses that are a part of our program, and Jan is going to tell you a little bit more about the program and how we do the certification process. I will say that as excited as I am to have Jan on board, she is less than 2 months into the role right now. But she has really come in and learned a lot about the program and really trying to help us to make that certification process better and more streamlined. And so with that, more than happy to take questions afterwards, but I'll allow Jan to talk as well.
Wonderful. And thank you so much, Assistant Secretary Bridges. Good afternoon, Madam Chair, Vice Chair, and members of the committee. Hope you guys can hear me.
Yes, we can.
Okay, wonderful. Great. So my name is Jan Walker Imago, and I am the Director in the Office of Minority Business Enterprise at the Maryland Department of Transportation. I am pleased to present updates from the Office of Minority Business Enterprise and our efforts to streamline the minority certification process in Maryland. Next slide, please. So in the office, there are 4 steps of certification at MDOT. We have an application section, investigation, evaluation, and last, determination, where applicants will receive an approval or denial letter based on our investigation. Next slide. There are 5 eligibility standards that applicants are required in order to get certified in our office. The first is ownership, where an MBE, DBE, and this is where you're going to hear a lot of acronyms, ACDBE is a small business at least 51% independently owned and controlled by 1 or more socially and economically disadvantaged individuals. So the list goes on to minority status, control, personal net worth, which has been raised this year. The new 2024 MBE personal net worth is $2,073,412, and this PNW statement is reviewed annually and updated. Lastly is firm size, where the firm must be a small business determined by size standards of the U.S. Small Business Administration. Next slide, please. And so the number of total certified firms in the state of Maryland, as Assistant Secretary Bridges mentioned, as of November 2023, we are proud to announce that we have 9,322 certified firms in the state of Maryland. In terms of application processed in 2023, in 90 days, we processed 293 applications. Greater than 90 days is 412. In terms of interstate applications, we process 40 in 60 days or less, and in greater than 60 days, 67. Next slide. And so just a quick update from our office in terms of staffing. We are evaluating the staff, the size of the OMB staff, as well as the various processes to determine what changes can be made, both short-term and long-term, to reduce processing times. Outreach. The Office of Small and Minority Business Policy is committed to increasing outreach to diverse populations across the state of Maryland. We provide a free monthly application workshop, which walks individuals through the certification process, and we do have a Q&A portion in that application workshop. Lastly, our application intake process we are taking significant steps to enhance accessibility and efficiency with our application intake. Our team in intake is working diligently to create a more intuitive and user-friendly checklist with clear instructions to ensure a smooth experience for certification applications. When applying, please, we encourage our applicants, and we encourage you to tell folks that are reaching out to your office to come and talk to us. We have experts in our intake office. We will conduct a 30-minute cursory complete application review with supporting documentation. They can email our office and schedule an appointment. And with that, that concludes my portion of the presentation, and I'll turn it over to Assistant Secretary Bridges.
Thanks, Chair. I just have one last thing that I wanted to at least mention to the members. We are currently in coordination with the Governor's Office of Small Minority and Women Businesses, working on the disparity study. As you all know, the disparity study is due in September of this year, and it's really a way for us to determine to the extent and how much discrimination may occur in the marketplace. With that, we always also use that to help determine what our minority participation goals will be. And so if you could, and you'll have this presentation, and we can also send this out to you, but please encourage any businesses to actually participate in this study. There's a QR code that they can use. They can also go to the website, which is www.stateofmddisparity.com, which they made me write down because I always forget everything about that, but stateofmddisparity.com, where they can take the survey. The participation is really critical to what we use to make sure that we are looking at the discrimination that really does exist in the marketplace. And so with that, thank you. I'm more than happy to take questions afterwards, but I'd like for the Secretary Chowdhury, if he's given his presentation now. Thank you.
Thank you.
Thank you, Assistant Secretary.
Good afternoon.
Good afternoon. For the record, I am Atif Chowdhury, Secretary of the Maryland Department of General Services. And we just want to give you a quick overview of the Office of State Procurement and how that plays a key role here in minority business participation. The Office of State Procurement essentially was established in October of 2019, just before COVID. And has been growing and really expanding ever since. And what we did recently this year is we bifurcated the office. Before it was a chief procurement officer and a deputy chief procurement officer overseeing the entire Office of State Procurement. We've bifurcated the office to help segregate and clearly define the roles and responsibilities that are there and help to expedite some of the processes and procedures that are there. We did it was essentially create two roles now. So it's a chief procurement officer role and two deputy chief procurement officer roles. We have our acting and our permanent deputy chief procurement officers here. I'll let them expand their roles here essentially, but one side would essentially oversee all of the actual procurement operations, the actual procurements, overseeing the procurement officers and the actual procurements themselves. And the other side would be the procurement infrastructure, the support arm, all the operations, the MBE, the PRG, which we'll get into and discuss, but everything else associated with that. So, and we did this to help streamline operations, but I'll let Jamie and Wallace both go over their respective roles. And then if we talk more, we'll talk about the procurement review process, how we assign MBE and VSBE participation goals to contracts, as well as what we're doing for the future and how we look to expand participation with MBEs and VSBEs in the future. So hand off to Jamie to talk about procurement operations.
Okay. Good afternoon. Nice to see you, Chair, Vice Chair, and the committee.
Good afternoon.
Appreciate the opportunity. So as the acting deputy chief procurement officer for the procurement operations bureau within the Office of State Procurement, we're doing all the acquisitions of all the procurements of everything under our delegation from the Board of Public Works as the control agency for state procurement. So we oversee the entire life cycle of the procurement, which includes building the solicitation, putting together the PRGs, and then posting the solicitation, obtaining bids or proposals, making that award and approving those contracts. So we do that for not only our Office of State Procurement,
procurements that we conduct on behalf of the state for statewide contracts. We oversee the agency contracts and depending on the dollar value of those procurements, we're either conducting them for the agency, overseeing them conducting their procurements that are mission critical to the agency where they have the expertise within their agency to conduct, or we're allowing the agency to conduct under their delegation. And then we have a follow-up which falls under Wallace's team for compliance to those procurements. So I'll turn it over to Wallace.
Thank you and good afternoon, Madam
Good
Chair,
afternoon.
Vice Chair, committee members. So I'll be brief. We want to get through our organizational structure. So I oversee, my name is Wallace Sermons again. So I'm the Deputy Chief Procurement Officer overseeing procurement infrastructure. Foundationally, that oversees the programs and support for the Office of State Procurement, divisions such as policy oversight, training, compliance, contract management, also several strategic socioeconomic and preferred provider programs, also the deployment and management of the e-commerce solutions and other information systems. We also oversee for Procurement Operations Bureau. We're broken into 3 different units. Now, this is the procurement operations side of the house. They're responsible for establishing all statewide contracts. They review and approve all agency procurements that go out. Also, agency procurements over the respective delegation of the agencies in which we serve as a control. Also support the establishment of the MBE goals, the VSBR, and whether something is set aside for SBR. We provide technical assistance to agency procurement professionals, and that results in about 600 plus procurement actions at any given time spread across approximately 40 procurement officers. Our Strategic and Sourcing and Procurement Diversity Bureau, that's the arm that's responsible for actual goal setting. That arm leads the DGS procurement review group meetings and establishes the participation goals for SBR, VSBE, and MBE. And they also coordinate the socioeconomic events. They provide the strategic sourcing and for Maryland's fiscal stewardship just to optimize value in the contracts that we're procuring. Then we have the Policy Agency Compliance and BPW Management Group. That group ensures that the OSP as a whole is aligned with the strategic objectives, policies, and procedures. They audit the delegated procurement authority that is provided to agencies, and they also advise on legal and procedural matters. They manage the publication of DGS's OSP's BPW agenda, and they also develop the procurement agency activity reports for those items that do not come on the agenda. We also oversee the Maryland Procurement Academy. That is who supplies the training and support resources, not only for the vendor community, but also for procurement professionals. And they oversee the design and implementation of several procurement certification programs. Our business services group, that's the reporting arm, and they support with budgeting, any reporting or financial data that's provided to stakeholders and regulatory bodies such as yourself. And also we have finally the e-commerce management bureau that plans, coordinates, and executes our e-commerce strategies. They oversee all of our information technology and information systems. So now we're going to go over, I'm going to pass it back to my counterparts to discuss the nuts and bolts of the procurement review group that assigns the goals at the procurement level.
So it's the procurement review group, but it's also a committee as well. So the PRG is responsible for reviewing all the procurements, renewal actions, or work orders and task orders that require goal setting so that we can maximize our opportunities for MBE and VSBE participation, as well as SBR designation. So what does that mean? As the Office of State Procurement, we have a policy that provides the agencies with the steps that they have to follow to conduct a PRG. Like Special Secretary had mentioned, there is a liaison in each of the agencies. So those MBE, VSB liaisons are responsible for the PRGs within those agencies. And then the DGS liaison covers all of OSPs, PRGs, as well as reviewing the agency PRGs. So we review every contract, every procurement contract opportunity that exceeds $50,000 for SBR, MBE, or VSBE participation. So So any contract 50,000 to 500,000, as we know, is now in statute that should be designated as an SBR. So that PRG process is for the agencies to confirm there are enough small business enterprises available to conduct that procurement as a small business reserve. And that small business reserve procurement is then designated, posted publicly, that only businesses that are certified as a small business enterprise can respond to that solicitation. So they become a prime contractor. Once that contract value reaches $100,000, we then look at subcontracting opportunities as well as prime contracting opportunities. So that's where the MBE participation and VSBE participation is looked at. In that scope of work, what opportunities are available, what commodities can be subcontracted, and any part of that scope of work, we ask the agencies to review that with their liaison, come up with a goal appropriate for that solicitation, and then they submit that PRG to our office, our PRG office, for them to review and make sure that that is appropriate. Or could there be more? Did they miss something? And so we have members within our agencies, which is our chief procurement officer or designee, the liaison, and then the ad hoc members are the procurement officers themselves, the program representatives, and any legal representative if they want to participate in those meetings to explain why they've set the goal the way they've set. And then we tell them what we think the goal should be based on that market research and reviewing the directories that MDOT has said, you know, they now have over 9,000 certified MBEs that allow the agencies to go out and see where those MBEs are, what they can subcontract and be a part of that contract participation. And then the process is followed to get that PRG approved. And once the PRG is approved, our procurement officers that oversee those procurements notify the agency when the solicitation is ready to be published, so that either the agency is publishing or our procurement officer is publishing on behalf of the agency or for a statewide contract. And then we hope to get the participation that we've sought based on those PRGs. And so here's an outline of that process, right? So the agency puts together their scope of work and the pre-solicitation stage and works on their PRG and then presents that PRG to us. And then there's the intake, analysis, recommendation, and approval process that our PRG unit goes through to approve that PRG for the goal setting for that particular procurement. And then it goes through the process of posting the solicitation and getting the bids or proposals for that procurement.
And it's important to note that the PRG process within the Office of State Procurement is a secondary check and a quality check for the PRG being conducted for an agency procurement. So they do their own analysis. There is a check and balance, a secondary check within Office of State Procurement to ensure that they did in fact have that goal or the necessary goal. And if it's not, then that's when the negotiation happens and the coordination of why and then a goal is properly set.
And I'm going to turn it back over to Wallace to talk about things we're doing to improve processes and modernize our PRG process.
Thank you. So the question is, what are we doing different? What are we doing better? As the Secretary stated, we had organized the Office of State Procurement with a focus on revamping procurement processes and procedures. So we've updated forms that are related to the process and undertake a value stream mapping activity to look exactly at the footprint of the PRG process and ways to streamline it, ways to enhance it, to ensure we're doing the best for the community. Next slide. More specifically, how we're furthering our MBE commitment. What we're doing is we're increasing our outreach and partnership with several stakeholders. We've been partnering closely with GOSBA to increase outreach and make sure we're collaborative in how we reimagine procurement goal setting. We're reaching out to collaborate with constituencies such as the NAACP of Maryland, different chambers of commerce, HBCUs, to increase outreach to underserved communities. We're being more transparent in our compliance process when it comes to MBE and VSBE contract goals as they are attained, providing information on the compliance we've had for contracts. And also looking at posting certain categories of procurements for a longer time past what's required in regulation to give those communities an opportunity to take the time to actually propose on those requirements. One huge step that we've taken is improving the procurement review group process for goal setting is requiring more in-depth market research. We've taken a page out of the federal government's book of looking at a request for information where we're being more collaborative with industry and we're asking those questions regarding subcontractable opportunities, seeing what vendors are able to accomplish. That way we have the information from our common stakeholders to determine what those goals should be and to ensure that the state does have goals that are commensurate with those procurements. And this concludes our presentation. We stand by for any questions.
Thank you. And I really thank you for your time and all your efforts. I would like to call back, please, the Special Secretary, Yolanda Maria Martinez, Mr. Tony Bridges, and Mr. Tomaszewski. You could stay there as well. And whoever will address the questions to help you can come up as well, okay?
Thank you.
So at this point, I want to thank you all for a very thorough presentation on every single program, which was wonderful. I don't recall seeing that. And I've been here a while. I mean, this thorough, so I thank you for it. And I want to thank our council for arranging all of these. She's the one that does the work and reaches out to you and staff as well. I'm going to open it up for questions now. Are there any questions for these three programs? I see Delegate Lewis.
Madam Chair.
Pleasure.
Thank you, everyone. It's good to see you, former delegate, but always delegate Tony Bridges. I was really impressed to hear about the MBE numbers. And I believe, ma'am, the new kid on the block, I believe you mentioned that there were over 9,000 registered MBEs. Can you give us a sense of how that may have changed in the last year or two? Like what was it in 2020 and how does that compare to now? Do we know? And I realize you've only been here 2 months, but.
Who's the best person to answer that question?
Unfortunately, I do not have that information readily available today, but I can certainly reach back out to your office and provide that information.
Excellent answer. You learn quickly. That's great. I know, that's wonderful. Any other questions? Delegate Taveras.
I could hear you better. Thank you all so much for coming out. Thank you, Madam Chair. Just really quickly, it was really nice to hear that you do have a monthly meeting to help individuals in the application process for the certification and licensing. Are any of these courses or whatnot or training provided in Spanish language?
I can answer that one. Yes, we do. I'm happy to say that, you know, over the last couple of years, we were the first agency that actually provided one of our workshops for certification in Spanish. This year, I believe we have 2 upcoming workshops in Spanish where I'm doing for the certification program as well. And we can get you those dates for those workshops. And I can send it to everybody if you like.
Thank you. Any other questions? Delegate Martinez, followed by Delegate Olston. Sorry, Delegate Olston, I did not see you. Go ahead.
Chair, and thank you all for your presentation. The last year, I've been doing a lot of just looking at how we spend our dollars here in the state, in particular around requirements of responsible contracting. Is there anything, I know that we don't have necessarily a responsible contracting law where certain provisions are outlined where if you do these things, you might not be able to get contracts, but what is, if you can go into kind of the vetting process of the people that we do business with, if you can go into that a little bit more detail?
Who's the vice person?
Procurement question. Hi, Jamie Tomaszewski, Acting Deputy Chief Procurement.
It's a procurement question. so
Yeah.
Go ahead.
I was interested to see who else was interested in answering. So, it depends on the procurement, right? There can be minimum qualifications within, the solicitation that the vendors would have to meet. And those are the offer or bidder must meet those requirements. And so they're spelled out specifically in each of the, specific solicitations. And that's why we're taking a much deeper dive into the scope of work and requirements when we're working with the agencies on doing their PRGs, because there's components in there that I don't think they can have considered in the past to be something that could be subcontracted, that we're really trying to reach out with our agencies to make sure that they're looking at everything within the scope of work that could be subcontracted to get more participation. You're welcome.
Delegate Olston, followed by Delegate Hill.
Thank you, Madam Chair. So I
Bless you.
have, I'm gonna try and do this in one question.
One question,
One
please.
question,
It's
please.
2:46.
Yes, ma'am. All right. Can you send us the actual dollar figures in terms of how much money is going to MBEs? And if any of the state procurement has government relations officers that are MBE contractors? So if a state agency is hiring a government relations person outside, are they required to follow the MBE rules?
So I believe that will be the first question. If you will be so kind and get back to us, will be for Special Secretary Yolanda Maria Martinez. The second one, I believe, is actually for the Assistant Secretary of Transportation, Equity and Engagement. Will you be so kind and send the answers to the entire committee, please?
Yes, ma'am.
Okay, thank you. My pleasure. Delegate Hill.
Thank you, Madam Chair, and thank you, Mr. Secretary and everyone, and certainly Mr. Bridges. So one of the problems we've had with subcontractors, not specific to MBEs, but generally, is that primes, I guess it is specific, load up with MBEs when they bid for the contracts, and then they drop them when they actually do the contract. So they get the contracts by saying, we're going to use so many veterans or small business or MBEs, and then that doesn't come through. So operationally, has that changed in terms of how we're putting things out, or are we monitoring that any closer?
Thank you for that. Thank you for that question. So through compliance is how we monitor it. But if once an MBE is named, they would have to go to the head of the agency. The head of the agency would have to approve them not using that MBE or going to another MBE. Through compliance, we would know if they're utilizing them to the extent that they stated in their actual proposal.
If they're not, then what happens? Do we take the contract away, or they can't contract again? Or
So
what?
then we look at the remedies available in the contract and we contact our AG for available. Like in some instances, we may look for a cure notice if there's a way to cure it. But in some instances, if they're towards the end of the procurement or that they've passed all of the subcontractable work, then we look for what available remedies are in the contract as far as terms and conditions. We also consult with our Attorney General's office.
Thank you. I have Delegate Johnson.
Thank you, Madam Chair. Delegate Bridges, good to see you, and thanks for the presentation. Can you give us that website one more time for the minority contractor survey?
Or can.
State of MD or just the email address?
State of MD. Everybody's telling me behind me. State of MD disparitystudy.com. State of MD disparitystudy.com. Should have it memorized by now.
It's okay. So I don't see any other questions. I do have one for the congratulations, the MB Ombudsman. Welcome. Can you tell us, I know that there are MB liaisons throughout. Tell me what your role will be with them, because ultimately they're so important to make sure that people understand these three programs, right? And to make sure that they use the resources that the state has. So I know you just started, but if you can answer it.
Thank you. So I will be working collaboratively with all of our agencies, especially those agencies that really contribute to our MBE goal, to make sure that the agency liaisons, but also the procurement staff are really understanding their responsibilities. So I'll be visiting those agencies and talking with the liaisons and the procurement staff. And also we'll be developing some training classes that'll be specific for them as well.
Thank you very much. And when I said earlier that this was the first time that I see this, meaning the collaboration, which is so great to see it, because a lot of people do not know, the roles of each office, right? And all of you do something different, but you're connected. So I think that collaborating together, it's really wise. And I thank you for doing that. And I don't see any other questions, but on behalf of our committee, I want to thank you for coming, for your presentation. As you know, your subject matter comes to this committee. If there's anything that we can help or do for you, please let us know as well. We want to be a partner as well. So thank you so much. And for everyone in the audience, thank you for your patience. For the committee, thank you for your questions and for your kindness. It is 2:51 and we're finished. And I hope you have